Oftentimes I'll ask guys, when I'm being intimate, I lose my erection. It's embarrassing. I think there's something wrong with me. And then I'll often ask them the question of, if you're masturbating, do you have any issue with your erection? And their answer is typically no. Then it's usually psychological in nature. It's a performance issue, that they're just too much in their head and they can't maintain their erection. But then there are those guys who, no matter what they do, even taking like medications like PDE5 inhibitors, like Cialis and Viagra, still not getting any improvement. Then it's time to investigate a little bit farther. I always say that poor erectile quality is like a canary in a coal mine. Yeah, so for people looking for these particular services, they're usually looking for things like firmer erections, improved sensation, or a longer flaccid hang. And from there, then they can decide which procedure is best for them. Yeah, so many guys come in because they have erectile dysfunction. And so they're looking for ways to naturally improve it without taking medications or avoiding surgeries. So PShot is a really great alternative for reestablishing healthy tissue, penile tissue, by using the PShot protocol. Most guys come in and have already done their homework. So they already know the name of the procedures, and so they know what they're looking for. So they're actually seeking out providers who are trained in giving the P-shot. So it is a trademarked name, and those of us who are providers for P-shot, Priapus toxin, P-shot 100, we're all members of the CMA, or the Cellular Medicine Association. And so it is a trademark name, and we are paid members of the organization, so we're able to use those names. Plus, we get all the appropriate training through CMA as well. So most guys have already figured out what procedures they're curious about. And then sometimes there may be a little confusion of what type of procedure they might need. And so that's where I can help them filter through. Yeah, some misconceptions are that they're going to get a big improvement in size by using the vacuum pump and getting the P shot. Now, theoretically speaking, there can be an improvement in size. There's actually a protocol that's used that's it's a P shot given once a month using a penis extender and a vacuum pump. Both of those used twice a day. It's called P-long, and over 6 months in the study, the P-long study, it showed that guys on average gained an inch in length and a half inch in girth. So, but that's using the protocol, and that's 6 months long. But typically for somebody coming in just to get 1 or 2 P shots, realistically, they're probably not going to get much as far as length or girth improvement. But the goal is to have firmer erections and improve sensation. Yeah, I think that they can fit in different categories. One is for rejuvenation. So as men get older, they're losing sensation. They notice that their erections aren't quite as firm as they used to be. So they're wanting improvement in that. And then there are those guys who've gone too far, and they get to a point where they can't get an erection or maintain an erection. And so the procedure works well for most people, but for some of those guys who have difficulty getting an erection, it may take 2 or 3 P shots before they actually get some healthy tissue growth and improvement in their symptoms. Right. Again, the misunderstanding could be that like this is maybe a one and done fix. And for some guys, it is. So I have some gentlemen that come in who really have no issues with sensation or even firmness of erections, but they're being proactive, and they realize that they're aging and they don't want to lose what they have, and so they come in sometimes once a year just for a touch up. But what's important with all of that too is these guys continue to use their vacuum pump daily. So it's the recommendation is following a P shot to use the penis vacuum pump twice a day for 10 minutes at a time, and it's ideal if guys used it at least once a day. Yeah, so Scrotal is a procedure that I perform here. It's using a toxin, our botulism toxin, like Jeuveau, Botox, that sort of thing, to help relax the scrotal tissue. So a lot of guys complain that they have a lot of retraction of their testicles and scrotum, even to the point where sometimes it's painful for them. So they'll find it like post-exercise if they're really kind of shrunk up a bit, when it's cold, obviously. And so sometimes it can be very painful, or it could be just a matter of cosmetics. They just want their scrotum to hang longer. So, so we use a toxin. We numb the scrotal area, topical numbing, and then small injections are given just intradermally, so just under the skin, so that it helps to relax that dartos muscle that surrounds the scrotum. And then over a couple of weeks, they'll start noticing relaxation, and they'll also notice less retraction. I do want to, dispel any misbeliefs that ahead of time as well. Some guys come in anticipating that perhaps they'll have like a larger scrotum from the procedure, or that they'll hang longer than they ever did. And that's not quite the case. This is just relaxing that muscle enough that it's not going to retract as severely as it did before. So PRP is platelet-rich plasma. Essentially, what it is when a patient comes into the office, when we get ready to set up for the procedure, I draw blood from their arm. To do the PShot, it's a 60 ml syringe of whole blood that's drawn from their arm, and then it's processed in a centrifuge, and actually it's a double spin centrifuge, so we get a really high concentration of PRP. Essentially, it's 5 to 6 times the concentration of whole blood when we're finished with it. And so within the PRP are growth factors, and that's where we get the improvement in skin tissue. So improved nerve generation, improved blood flow, better vascular flow. And so that's primarily the purpose of PRP. So we discovered that PRP is used in many areas of the body for healing, long before we used it for sexual medicine. Dentistry's been using it for a long time. In procedures, wound care uses PRP for poorly healing wounds. And so we're finding that it improves in sexual health as well. So essentially, the way that this works is that once a guy comes in for the procedure, obviously we talk about what the steps are. I apply a topical numbing agent so that they get completely numb for the procedure. While that's all happening, we process the blood to separate out the platelets. And then we're ready to do the procedure. The area's cleaned really well. And then there are 5 injection points where the PRP goes in. So it's a total of 10 milliliters of PRP, called the yellow gold, because in syringes it looks yellow in color. It's where the gold is. And then those are injected along each side of the penis, and then one near the head of the penis called the corona, which is the ring around the glands or the head of the penis. The procedure itself is pretty quick, maybe 15 seconds from the time I get started. And there's virtually no downtime. So obviously there's always a chance that there could be a bruise, and that's not uncommon. There could be some bleeding, but usually after the injections are given, usually I hold some pressure for a bit so that there's no bleeding or bruising. And then I always tell guys, once the numbing medicine wears off and you have full sensation back, then I want you to use your penis. So I want you to go home, use the vacuum pump, which when you're here, when the guys are here, I show them how to use the pump properly, so they can use it without any danger. And then go home and use the pump, or have intercourse, or whatever it takes to get blood flow through the penis, to get those platelets activated. So growth factors are going to be released from bone marrow. So anytime that we're creating some trauma in the body wants to respond by sending in growth factors. So the PRP is going to stimulate this. What we're doing, though, is after the procedure, by encouraging guys to use the pump, they're actually creating little micro traumas, little circumferential micro trauma in the penis, ones that can't be seen by the human eye, but the body wants to go in and respond and repair those. So it's it's recruiting stem cells from the bone marrow to go in and regrow that tissue. Hence, then we get improved sensation and better blood flow from our erections. Well, obviously, the goal is that guys will get firmer erections and improve sensation. But what's important is that the guys do their homework afterwards. So it's not a matter of just coming in, getting the procedure done. It's a matter of doing your homework and really being serious about committing to using the pump twice a day, 10 minutes at a time. That's going to get the best results. So usually within about 6 weeks after the procedure, guys that were having issues before will start noticing improvement because it takes time for new cell turnover before the procedure actually shows some benefit. And again, as I mentioned earlier, some guys, are in fairly poor health or penile health. And it may take 2 or 3 procedures to get them back to a healthy state where they can maintain an erection without using the pump. And then they'll notice some improved sensation as well. But the other thing too is, guys that that have these concerns about erectile dysfunction, in addition to the procedures, I always talk to them about what possible causes could be. One could be, is this psychological? Oftentimes they'll ask guys, they'll say, when I'm being intimate, I lose my erection. It's embarrassing. I think there's something wrong with me. And then I'll often ask them the question of, if you're masturbating, do you have any issue with your erection? And their answer is typically no. Then it's usually psychological in nature. It's a performance issue, that they're just too much in their head and they can't maintain their erection. But then there are those guys who, no matter what they do, even taking like medications like PDE5 inhibitors, like Cialis and Viagra, still not getting any improvement. Then it's time to investigate a little bit farther. I always say that poor erectile quality is like a canary in a coal mine. Right. So if a guy is having issues with erections and we rule out that it's not psychological, then we're leaning towards maybe more vascular in nature. And so sometimes that needs to be investigated further by specialists, see urology, and also then looking at their lifestyle. Is this somebody that needs to see cardiology? They need a cardiology workup, perhaps, because we know they're not getting good blood flow to their penis. They may not be getting good blood flow to their heart or the coronary arteries or carotid arteries. So when a guy comes in for the procedure, I have him change into a gown. So everything from the waist up, from the waist down should come off. I give him a wrap to cover with, keep his modesty. And then wherever I'm going to draw blood for the PRP, I put a little topical numbing on there. Might as well make a blood draw pretty painless as well. And then I'll put topical numbing medication on their penis. So typically I use tetracaine and lidocaine, providing they don't have any allergies to those medications, and wrap it with a little bit of like a plastic wrap just to keep it all occluded so that it doesn't get everywhere else on their body. We don't want other areas like their legs or scrotum to get numb as well. It takes about 20 minutes for the topical numbing to really get a good effect. So while that's happening, I will then draw their blood and start processing it to extract out the PRP or the platelets for the procedure. So once the platelets are ready, then I will lean them back in the chair, clean up whatever excess topical numbing medication may be on there, use disinfectant, and then do the injections, the 5 injection points, which takes all of about 15 minutes. So from the time they walk in the door to the time they leave, it's almost always less than an hour. Some of that time is spent when they first come in because I show them the vacuum pump and all the equipment that goes with it. So I always use the Dr. Joel Kaplan vacuum pumps. They're battery operated. They're really safe, along with using water soluble lubricant for the cylinder of the tube so that it doesn't break down the cylinder. So that's before I do the procedure, I actually go through the use of the pump with them first so that I know that they're successful with it, rather than going home trying to figure it out and then get frustrated and not being able to use it. So about an hour in office. The procedure itself takes maybe about 15 seconds to do. Most of the time is spent teaching and waiting for the numbing medicine to take effect. And then essentially no downtime. Once the topical numbing medication wears off, I want them to use their penis. I want them to wait until that they have full sensation so that they're not injuring themselves inadvertently because they're still a bit numb. So once that topical numbing wears off, it's about 2 hours, then go about their day. And there should be no limitations. There's virtually no pain. They should have absolutely no pain at all after the procedure and after the topical numbing wears off. I often tell this to the potential patients. I give myself PShots, and they work amazingly well. And I don't use topical numbing medication when I do mine for two reasons. One is I want to be able to prove to patients that this is not a very painful procedure. And when we add topical numbing to it, it makes it even more pleasant. And two, I personally don't like being numb for 2 hours afterwards. And so I just do the procedure by itself. And I have several patients who, after their initial or second or third PShot, they come in and they're like, yeah, let's not use numbing. I'm totally fine with this procedure. I know it's not very painful. So not everybody needs topical numbing medicine for this. Good candidate is going to be somebody who's going to commit to the process. So somebody that is going to use the vacuum pump 10 minutes twice a day, ideally for the first 8 weeks following the procedure. I always encourage guys to use the pump once a day if they can fit it into their schedules continuously. Another good candidate is somebody who may not have any kind of erectile dysfunction, but wants improved sensation and just wants firmer erections, or they're wanting to be proactive and, perhaps like ward off any kind of issues that might occur as they age. So they're being proactive with this. I would say who is not a good candidate for this. One is, again, somebody who's not going to commit to the process, or somebody who has severe erectile dysfunction. So before doing the procedure, I have the guys fill out a SHIM score, SHIM, sexual health inventory, and it's 5 questions, and the best possible score is 25. So 25 out of 25 should have absolutely no erectile issues. But those lower scores, those middle to lower scores, sometimes is a red flag that there might be some other issues going on there. But at least it gives us a baseline so we know where we're starting. And then on subsequent PShots, then we can compare what their scores are and see the improvements along the way. Yeah, I have turned a couple of patients away because they just weren't healthy to begin with. I didn't want them to waste their money, and I didn't want them to build up hope, thinking that this would work for them. I was pretty sure that their erectile dysfunction was pretty far advanced, that a PShot or two may not be the answer for them. And so their best bet is to follow up with urology to see what other options are. But usually men who exhaust their efforts using things like PD5 inhibitors, the Viagras and the Cialis, those aren't working for them, then, or even Trimix, which is a self-injection of medication to create erections. If those aren't working for them, then a PShot likely isn't either. Yeah, there's a risk with every procedure we do. I always tell patients that anytime that we're breaking through the skin with a needle, there's always a chance of infection, almost always a chance of a bruise, but the risks are really, really low with this procedure. I think, if a provider first of all, if a provider was doing this procedure and they weren't properly trained, that's a big red flag, right? So using the right length and size of needle is very important so that we're not going too far in. We're not going to go through the cavernosum, which is the big blood vessel that runs on each side of the penis, which fills to make an erection. So that and again, anytime we're entering the skin, there's always a chance of infection, but we use a disinfectant. I've never had any patients with any complications at all from a PShot or any PShot like procedure, and we actually use PRP to treat infections. So it's very unlikely that somebody would get an infection from this procedure. I would say realistic expectations would include seeing improvement over time. So, not necessarily expecting it to happen overnight, but somewhere between 6 and 8 weeks while using the vacuum pump daily as directed, should expect to see some improvement. They should start perhaps waking up more often with morning wood with erections. They should find that their erections are more spontaneous, that they're firmer, and they're able to maintain them long enough, like maintain them enough for intercourse without going flaccid. Those would all be telltale signs that the PShot is working for them. Yeah, so the PShot is not necessarily a standalone procedure. Other things that can help enhance that are you're checking to see if a guy is his testosterone levels are appropriate, and if not, is he on TRT? That would be a big one. The other thing is to consider taking with this a low dose tadalafil. So I often encourage guys with this procedure to take tadalafil 5 milligrams daily. It really does help to improve blood flow, and especially during this sort of post procedure time of 6 to 8 weeks. So that will also enhance the effects of the PShot as well. So yeah, low dose daily tadalafil works really well for improving blood flow. Just helps the procedure work a little bit quicker. And the other thing I wanted to mention about the PShot too is that it is often used for men who have Peyronie's disease. So Peyronie's disease is a curvature, an abnormal curvature of the penis, which can oftentimes be painful. There are injections and medicines that can work for that, but they're really, really expensive and they have some downsides. So the PShot has been shown to improve Peyronie's disease, both with using the PRP and using the vacuum pump daily. So it can help to really straighten that out a bit. And, the other thing to consider too is I mentioned using the PD-5 inhibitors. And the other thing something else that men can consider with the PShot is things like shockwave therapy. I don't offer those in my practice, but in conjunction with the PShot, the studies have shown that there's great efficacy using both of them together. Yeah, I think the PShot can be used in conjunction with a PD-5 inhibitor. But I find a lot of guys who have taken them for quite a while and then come in to get a PShot find out that they don't need them after having the PShot because they're getting penile tissue back into a healthy state. But there's definitely no contraindication to continuing to use the PD-5 inhibitors like Cialis and Viagra in conjunction with the PShot. So botulinum toxin or Botox, Jeuveau, Xeomin, those are all brand names of botulinum toxin, are used in sexual medicine. And so we know that using them, say, for instance, on the face, the muscles of the face, they relax the facial muscles over time. There's less expression. But when we talk about it in sexual medicine, so many people have questions because they think it's doing just the opposite. It's relaxing, and we don't want that when it comes to erections, right? But the way the medicine works is that it's also working on smooth muscles, and as we know, there are smooth muscles that surround blood vessels. So the toxin helps to relax the vessels, and then with that, obviously, firmer erections, but also a longer flaccid hang. So in a non-erect state, penis can hang longer, which a lot of guys find a benefit of, especially those guys who are more of growers than not showers. So having that tox in there helps relax the penis more. Yeah, so the Priapus toxin is strictly using botulinum toxin or Botox injected into the cavernosa of the penis without using PRP. So it's typically, I find that it's younger guys who don't have any kind of erection issues, but they're just looking for a longer flaccid hang, or they don't want to mess with the process of extracting blood and doing the PRP. So they opt in for the Priapus toxin injection as well. So that Priapus toxin is, again, going to relax the smooth muscles, so improving blood flow longer flaccid hang, and firmer erections are the main goals of the Priapus toxin. I find that most guys who are interested in using a tox, they usually bypass the Priapus toxin and they'll do the PShot 100, which is essentially the PShot with 100 units of tox in it. Yeah, so the PRP is essentially used we're wanting to improve tissue growth. So we're wanting to improve blood vessel health and nerve tissue health. Using the tox alone is more mechanical. It's helping to relax the smooth muscle around the vessels so that there's more blood flow and as a result, a longer flaccid hang. Yeah, so a lot of guys will ask, well, which procedure should I do? There's the PShot, there's the PShot 100, and the Priapus toxin. So again, we want to talk to them about their goals and of course what kind of issues they may be experiencing. But for guys who want the PShot, but they just want, I'm going to say that turbocharged, then it would be the PShot 100. So it's the PShot with 100 units of tox added to it just to enhance the benefits even more. And that procedure typically lasts about 6 months using 100 units of tox mixed in with the PRP. So it's not a separate procedure. They're not injected any additional times. It's just that when the PRP is processed, at the very end, the 100 units of tox is added to the syringes before the injections are given. Yeah, I have guys that do that. So they'll often start with just say the basic PShot. They want to try it out. They don't want to make a big commitment. It's not a cheap procedure, but oftentimes they'll start with the PShot. And then subsequently they're like, yeah, that was really great results. I want to see even more. Let's do the PShot 100. So, but on occasion, I have some guys who, cost may not be an issue for them. And so they just want to go for the gusto right off the bat, which is totally fine. And then the other question sometimes I'll get from guys are, how often can I get this procedure? Essentially, it's what your calendar and your budget will allow. Between PShots, if we're looking to see, kind of measure improvement, we say every about 6 to 8 weeks just to see if we're having some measurable improvement, repeating the shim score that we did before. But we can do them more often than that. I mean, during the P-long protocol, men are getting a PShot once a month for 6 months. Yeah, so I would say the difference is probably going to be age. So I'm going to say the Priapus toxin is probably going to be for a much younger patient, somebody who has no erection quality issues at all, but they're looking to have a longer flaccid hang. There's somebody who is a grower and not a shower, and they want to show more. So the Priapus toxin would be for that person. I would say the guy who is experiencing some erectile dysfunction issues and is looking for some improvement. He's tried PD5 inhibitors. They're helping somewhat. I would say the standard PShot for him. And then for a gentleman who, has maybe tried one or two of the PShots, hasn't gotten quite the results that he was expecting, then I would say that's time to introduce the PShot 100, sort of the supercharged PShot. Yeah, so only members of the CMA or Cellular Medicine Association are able to perform the trademarked procedures, such as the PShot 100, the Priapus toxin. So we've all been trained from somebody in faculty at CMA. I just so happen to be trained by Dr. Charles Runnels, who is the founder of CMA, the founder of the PShot and all the other PRP procedures that go along with that. So I traveled down to Alabama where he's located and trained with him and other colleagues directly to get training for this procedure. Probably want to mention again about the CMA. So somebody that is advertising the PShot or procedures like it, it's best to check to see if they're an actual provider. And the best way to do that is just to go to the Cellular Medicine Association, plug in the provider's name and state, and if they are a member, it will pop up there. So, there are a lot of people offering procedures like this, but there are a lot of imposters out there. So I would definitely be aware of people doing these procedures without proper training. That's always key. Yeah, so I know Dr. Reynolds often uses analogy, when people talk about the cost. So I don't, and I could probably mention this on video here as well. So I don't get to set the cost for the procedures. The MSRP is set by the Cellular Medicine Association. So I have to charge whatever that base price is. I can charge more than that if I wanted to, but that's the base charge that all patients should be offered. And so, yeah, it's always best to make sure that there are no gimmicks out there, that people aren't offering this at a lower price. If so, they're probably not members of the CMA. So with the first P shot or the first P shot 100, men get a vacuum pump, a cylinder, and water soluble lube to take home with them. It's part of the package for doing their homework properly, so that they make sure that they're pumping as we direct. 10 minutes, at least 10 minutes twice a day. So I set them up for success. So they have all the equipment that they need when they leave here. And so that is a part of the initial price of the PShot or the PShot 100.